My name is James Wayne. I attended Gwinnett Mercy University. I received my bachelor's degree in healthcare management. I work for Johnson and Johnson. I work for the biotech pharmaceutical division. I'm a senior manufacturing technician there, and I've been there for 21 years. I worked in the chemical industry before, so it was kind of easy to transfer that. It was like certain practices in healthcare and chemical that are similar, so it kind of helped me get in the door. Johnson & Johnson researches, develops, manufactures, and sells pharmaceutical and medical device products. When I started there, I was just a tech. And you can go to Tech 1, Tech 2, Tech 3, lead, supervisor, manager, roles that are available, or they can make a role for you too. If you don't want to do a lead or you don't want to do the supervisor, they'll make a way to create a role for you. So the shift for the position is a rotating shift. It's a 12-hour shift. It's 2 on, 3 off, 3 on, 2 off. So I work every other weekend. I'll do Saturday, Sunday, Monday, 36-hour week. So it's like overtime built in every other week. Some weeks are short weeks. Some weeks are longer weeks. My typical day starts in our office. It's at 6 a.m. We start out emails. Check all your emails. Make sure you ain't got nothing important in there. We'll do our morning meeting and we'll discuss any issues that happened the previous day, anything that we need to fix from a previous shift that might have been updated, print out our schedule, what needs to be made for that day, what raw materials that came in that need to be sampled. Normally we got training due that we have to sign off on. So it's 3 or 4 of us sometimes. And we'll delegate who's going to do the sampling, who's going to do the weighing of the raw materials, who's going to distribute it to our customers in another building. So that's what we put together in the morning. So depending on what I decide to do or what we all decide to do, then we'll go to a lab. Like that's where I start weighing out materials and stuff, and it's in a lab, A lab or B lab, whether you're going to work in A lab and do sampling or B lab and do the weighing of raw materials. We depend on each other. Everybody's got their role they play. It all depends on what you want to do that day. Most satisfying is helping the patient. At the end of the day, it's giving people a better quality of life on the product that we're making. Because the product that we're making, it's for Crohn's disease, rheumatoid arthritis, and a lot of other things. So that's the satisfaction. You actually, they'll have patients come in, we'll do a meeting, they'll talk about how the product enhanced their life. The most challenging, because we work in a regulated environment, we're regulated by the FDA, EU, and a number of other agencies. If we want to make a change to a process, if we want to try to improve something, it's a lot of people that you got to get involved. It's a lot of paperwork that's involved, and it's a lot of time. So change around there is not easy to a process. Some of the skills and core values that you need to fulfill this position, I think, is focus, honesty, teamwork, attention to detail, organizational skills, planning, time management, willingness to learn, and work ethics. For a high school student or a college student that wants to come to this position or get into this position, I think number one skill is invest in yourself, whether it's public speaking, joining a group like Toastmasters. Definitely get your degree. It's not only going to help you get into this position, it'll help you get into another position also. I think it's important to continue to invest in your education. Get a technical certification, whether it's in pharmaceutical or chemical or any other background that would kind of open a door for you. Update your LinkedIn profile, get a mentor, definitely. Research some pharmaceutical companies and see what they're looking for. Learn how to network with people. Networking is important because the people that I know and the people that I network that's in the pharmaceutical business, they actually can help you get into another pharmaceutical company because you've worked with them. And they know your experiences and they know the type of worker you are. So I think networking really is a good way to get into this business.